Hi, I'm Dr. Trevor Murray. I've been here at Allure Dental for 29 years, and I love doing veneers. With veneers, oftentimes we can do a smile makeover where we take somebody whose smile was average, below average, or they just didn't like it. Maybe it wasn't that bad, they just didn't like it. We've had Miss USA patients come in and they're like, um, hey, my smile is not great. Well, by other people's standards, it is, but they just want to make it perfect. And so, with veneers, we can take somebody who obviously has a below average smile and make everything beautiful, make it perfect, make it look like they were just a model or ready to go to Hollywood. And it's a blast. It's a blast to see their expressions. It's a blast to see them go from good to great, from poor to great. And it's a delight. We had a patient from New York today, and she came in and we only did one veneer, but it was just delight. She was so excited. She kind of gave it a fist pump, and it's fun. We did that in one day, and she flew in and is flying out in a couple of days. So um, it's really cool. For someone who's never heard of veneers before, um, explaining it would be basically just putting like a new front, kind of like fingernails, but a lot more permanent. Just making things that aren't so pretty, making them beautiful, shiny, perfect, make everything uniform in size and shape and color, especially. Color is a lot of the times, maybe they had staining when they were a kid, maybe they had intrinsic staining from some medication, and the color of their teeth is just not attractive. And what we see today, and especially with all the social media, people want to have a smile that is inviting and just beautiful. And so we can do that basically in 3 weeks. We can go from a smile that's not attractive to a smile that's perfect in about 3 weeks. And it's very rewarding for the patient and for myself. What types of things can veneers fix? Veneers can fix all types of anterior wear, chipping, crowding. Um, we take teeth that can be overlapped. Instead of going through Invisalign, which could take 6 months to a year and a half, we do veneers and we're able to make the teeth look straight when they're not straight. We're able to fix chips and breaks. Sometimes they'll have big fillings on them that are discolored, or they'll have a temporary filling on it that has where it's been broken or chipped and somebody was just trying to get by. We work with the Purdue basketball team, and oftentimes they get elbows and chips and breaks, and oftentimes we end up doing crowns and veneers on those teeth just to make them look perfect and make them look so they can go on camera and smile and be confident. And I think one thing veneers fix it's probably the biggest thing is just confidence. People oftentimes don't smile because they don't have confidence with their teeth. When we do veneers, they're smiling from ear to ear. Their smile actually gets bigger. So when we think about veneers, we don't just think about what their smile is going to look like right now. We'll think about what their smile is going to look like in 2 or 3 months, and we'll make their teeth bigger, brighter, because as their confidence grows, their smile grows. And that when they come back in 6 months and they have their veneers done and their smiles, twice as big as it once was, it's amazing. It is simply amazing. And their confidence around people, their confidence with their loved ones, um, yeah, it is off the charts. How do I help patients decide if veneers are right for them? When patients come in, oftentimes we talk about all their options. So we'll go through um, veneers, we'll go through crowns, we'll go through Invisalign, we'll go through sometimes even implants, full implant cases, and just decide, give them all the details, give them all the information. My job as an educator is not to push patients one way or another, is to give them all the information. When they have all the information, they can make an educated decision on what's right for them. Oftentimes, we see veneers when their concerns are mostly cosmetic. Veneers obviously are correct for them, or they need something quickly. They want a smile that's just more instant. So they have a wedding coming up and they want veneers. They have a big job interview coming up. They want veneers. Um, or the other side of it is they just want perfect teeth. So their teeth may be discolored, their teeth may be crowded, their teeth may be chipped. And they're like, well, I want them straight, but I want them to look perfect at the same time. And perfect cannot always be attained by doing Invisalign or other treatments. Usually veneers is the way to make them perfect. What's the process from the first visit to final results in veneers? The patient will walk in, they'll do a consult. We'll use a 3D image just like we're using here, and we can explore all the parts of the mouth. We can look at the teeth in all different angles, and we can kind of give them an idea. We can actually do a digital wax up and also a regular wax up. When I say wax up, we'll do a mock up of what their teeth are going to look like, so they have an idea of what that's going to look like. We can actually even put that on their face if that's required. Um, and then once they give approval, we take that wax up and we make it so it'll transfer to their teeth. And so they come in, we'll actually numb them up, grind on their teeth a little bit, and then put those mock-up veneers or fake veneers on their teeth. They can walk around if they like them. If things look good, then we go ahead and move to the final. If they want to change things, if they want a wider, bigger, different dimensions of the teeth, and then we can change it, and then we can go to the final veneers. Usually the process is about 3 weeks. We can change everything from the size of the teeth. We can raise the gums. We can increase the size of the smile. We can actually widen the smile. Usually the options are boundless. I mean, it is a personalized teeth overhaul. Do veneers look fake or obvious once they're in? The answer to that is no. They don't look fake or obvious. They do look perfect. So some patients, they're kind of apprehensive that they say, I don't know, my teeth look too perfect. But for the average patient, they want their teeth to look perfect and amazing. That's always customized to each patient. So each patient tells us what they want. We listen to the patient. We go from maybe a Hollywood smile where the teeth are perfect and just ideal to Hollywood and what you'd see in maybe magazines, pictures, where you see some of the movie stars and even some of the stars that we've actually worked on. Sometimes they'll go for that Hollywood look. The other way we can do it, we go with a natural look. So more curves and more translucency just to make them look like nothing's ever been done, although they still look perfect. In between those are there's a way called enhance, and it's kind of in between. And so with all those things, there's about 16 different styles, and we can go with different colors all along. I say different colors, like all this lighter shades of light is what we're looking at. So we want to make the patient look really the way they want to look. It's not so much my design and what I want; it's the patient and what they want. So everything's custom designed to the patient, for the patient, by the patient. What do patients say when they get veneers for the first time? Tears are a real common response because most of the patients have been um, toiling with a smile that they don't like. Oftentimes, I'll show them these pictures, and they don't want to look at the pictures. They're ashamed of their teeth. They have gone their whole life without smiling, and all of a sudden, they get to smile. They get to laugh. They get to open their mouth when they talk. You'd be amazed how many times patients put their hands up over their mouth, how much they keep their lips shut when they're not excited about their smile. When they get excited about their smile, their confidence is off the charts. They smile big for pictures. They smile big for pretty much everything. And they just grow and grow and grow. So as we see them, a week, 2 weeks after, see them 6 months after, their smile gets even bigger and their confidence grows more and more. And that's not to make them say they're cocky. They just smile and they just are happier people when they get veneers, which sounds absolutely crazy, but it is so true that a smile, if you hold a smile for 5 seconds, 10 seconds, you can just feel that inside making you better. If I am smiling, even to myself, if I'm holding my smile for 10 seconds, then I get feeling better. I get more confident. I get it makes my day better. And it just causes hormones to flow if you're smiling. And these patients are just happier and healthier because they're smiling more. If someone were to start with Allure Dental, the best way to schedule an appointment is just a free consultation. And basically, what we do is we'll sit down just in a chair, knee to knee, and just say, "What do you want? What do you want your teeth to look like?" And then I'll show you some things that we've done in the past, some patients that we've worked on, and show you the results, and basically go through the steps of finding out what they want. I've even had patients want spaces in their teeth still. That's really rare, but we have done that where they've even left spaces. Not something I would prefer, but it still looks great because it's individually to them. So we'll sit down, go through all the options, and then we do what's called a mock up or a wax up. And then we get their teeth to where they want to go. So they'll look good, feel good, and last a long time for the patient. And their confidence, of course, is off the hook.